So I'm here with Dr. Nicole Distano,
Hi.
and we are going to be demonstrating some treatment techniques that we use in the office, because a lot of times people ask us and question, what does a typical chiropractic treatment look like? And like as I was saying in different videos, there are different techniques that we could do to help decrease pain and increase range of motion. Two of the most common that we do are what's called mobilizations, which are just slow, gentle pressure throughout the spine. And the other one's a manipulation, which is classically associated with what people say joint cracking or joint popping. So we're just going to demonstrate what we would do for somebody with mid-back pain, mobilizing them, and also we're going to do a manipulation so you can see what that looks like. So mobilization is just gentle pressure to an area of the spine, as I said before, to increase range of motion. And it's not actually taking the joint to the furthest end range, so you won't hear any joint cracking or popping associated with that most of the times. Now, manipulation, the joint is actually going to be taken through its full range, and many times you will hear joint cracking or joint popping, which is really air bubbles forming within the joint. So take a deep breath in, all the way out. And then at the end, we give a little thrust. So the main difference between the mobilization and the manipulation is the speed that it's done and the range that it's done in. So it's a short, fast thrust. We also have a manipulation technique that we use for where the neck meets the shoulder area by the upper trap. It's really effective. And again, we can mobilize that area just by putting light pressure through different ranges. And this will be done for different periods of time and different levels. And then to manipulate that area, you just bring the head over to the side, have them take a deep breath in, out, bring the joint to the range, and then give a little thrust. Okay, come on up. So those are just two examples. Again, it really is dependent on patient presentation, patient preference. Sometimes we do both of those techniques in one visit. Sometimes we may choose one or the other, or we may not even do either one of them. Sometimes we may just do some stretching or some exercises.